appointment as the Minister of Health. Thank you very much. We know you are not new in this portfolio as you have been there. Let me also welcome all the people who are joining us on the different platforms, including also members of the media who are part of this session. Let me also welcome the teams that will be presenting, including or led by our DG, Dr. Sandy Debutelezi. Also to acknowledge the presence of Professor Glenda Gray, Ms. Jackie Mayman, Dr. Anben Pillay, Mr. Wesley Solomon, amongst the ones, and everyone who has joined us, especially the officials from also the Department of Health. This is part of the normal regular briefings by the Department of Health that happens on every Friday at 7:30. Without taking much of the time, I will then request and welcome the Honorable Minister of Health, Dr. Joe Phaahla, to give us the opening remarks. Thank you very much, Doctor.
Thank you very much, Mr. Baloyi. Let me also thank you for standing in at a very short notice. For those who don't know Mr. Baloyi, who are few, especially in the media, he is a veteran communicator. So we are indeed very blessed to have him facilitate this morning. And thank you, and also to the rest of the panelists. Let me first thank our Excellency President Ramaphosa for having given me the honor of this responsibility to steer the Department of Health. I know that this is very stormy waters at this time of the pandemic and many other challenges. Indeed, therefore, it's an honor and privilege for me to have been given this responsibility by His Excellency President Ramaphosa. I also want to thank him for also appointing a long-standing colleague of mine and comrade, Dr. Sibongiseni Dhlomo, as the Deputy Minister. Unfortunately, Dr. Dhlomo won't be with us this morning. You all can imagine that it's been quite hectic the last 12 hours or less. So Dr. Dhlomo still has to get himself, organized. He doesn't live in Gauteng. We will be having a swearing in later on, so he's got to be traveling and be ready for that. But I'm very pleased that the President saw it fit to appoint somebody with a lot of experience, as many of you would know, Dr. Dhlomo, a former MEC in the in the 5th administration in the province of KwaZulu-Natal. Let me also acknowledge the contribution of my predecessors. Firstly, a long-standing comrade and colleague of mine, Dr. Zweli Mkhize, for his very sterling work in this 6th administration, steering the department. When the pandemic, COVID-19 pandemic started, he's the one who has been leading us, and I owe a lot of gratitude to his stewardship. And also in the last 2 months or so, Ms. Mamolo Kukubai, who stood in when Dr. Mkhize was on special leave. I want to thank her also for her contribution in steering this ship during that interim. Now, ladies and gentlemen, as we meet this morning, the third wave is indeed still upon us. We're still going through very difficult times in terms of the third wave. As of over the last 24 hours, there were 13,777 new cases of COVID, a slight increase compared to the day before, which was 13,263. And in this regard, we remain concerned. It's quite clear that the third wave is taking no different pattern, but very similar pattern to the first and second wave. We know that in this third wave, largely the epicenter has been the province of Gauteng, which at some stage as a province alone reached the heights of 16,000 new infections in 24 hours just as a province. And also that pushed the country to go to levels of 26,000 in 24 hours. So we are very encouraged by the fact that there is a consistent and steady decline in terms of the daily infections. But just similar to previous, the first and the second wave, we can see that when the epicenter starts in a particular province, and then from there the surge moves into different provinces, and we can see now that it's moving into the coastal area. The Western Cape has been, over the last 7 days, the Western Cape province overtook Gauteng province as the one with the highest numbers, the new epicenter. Yesterday was the same, with over 4,000 new infections. We are very encouraged by the fact that Gauteng has been declining, but we can see also that at the same time, as I mentioned, the coastal KwaZulu-Natal is also rising, and also in a way, the Eastern Cape is also rising, even though not at a very steep rate like Western Cape. But we're watching this because this is presenting a very similar pattern. And what we are looking at is the fact that we need to work with the province of the Western Cape, make sure that they can be able to do all the tried and tested measures in terms of containment of the infections, make sure that they have the ready bed capacity, all the consumables, the oxygen, and all other necessities to make sure that those who need hospitalization can be looked after. We hope that not so many will need high care and intensive care, but knowing that this will happen, that some, unfortunately, some citizens will end up in high care and even in intensive care. We're working with the province to make sure that this should be ready, but also those who need who are stable but positive, who need isolation and observation in ordinary hospital wards. We're making sure with the province of the Western Cape that this should be ready, but also the question of contact tracing remains very important as part of the containment. So we will be monitoring the situation in the Western Cape, in KZN, and as has been the pattern before, we are worried also that the Eastern Cape may very quickly, in a few weeks' time, start to be engulfed in terms of the surge of the infections. So we will be watching this with a hawk's eye. So in the next few days, I hope to pay a visit to the Western Cape just to make sure that we can discuss with the MEC and the leadership of the province, just to be sure that there is adequate containment measures. At the same time, I must say that we remain concerned about the Northern Cape as well. It hasn't really declined as we had hoped for. So I know my colleague, Minister Kubai, was there last week, spent a few days there. So I will be following up with the MEC and the leadership of the Northern Cape, just to pick up, and together with the Director General, we will be following up with the team from National to take from where Minister Kubai left in terms of working with the Northern Cape to stabilize the situation there. Equally so with the Northwest, still some worrying trends with the Free State as well. It's going up and down. It hasn't risen above where it went in the second wave, but we remain concerned also about the Free State province. The other provinces are promising in terms of stabilizing. Mpumalanga shows also some trends of instability. We will be also working with them. Limpopo province is promising in terms of a reduction in the infections. So while we're doing this, as honorable members and the public are aware that on the one hand, as we are stabilizing and making sure that those who are already infected are looked after and that we reduce the rate of infections as much as possible. The next point which I want to spend some time on is the fact that we also rolling out our vaccination program as a preventative measure. We are very pleased with the support of our president, our deputy president, colleagues in cabinet, in the interministerial committee on vaccinations, in terms of giving us the support, our colleagues in provinces, our MECs, HODs, and all the field workers, the health workers. We're very pleased with the stabilization and ramping up of our vaccination program. As of yesterday, we again reached a milestone of just over 8 million vaccinations overall. This includes first dose vaccinations in terms of the Pfizer. As we know, we're currently still using only 2 vaccines, the Pfizer, which is a 2-dose, and then the Johnson & Johnson, which is a 1 dose. So this at the later stage, this will be broken down to show in terms of which one out of the 8 million is the total vaccinations, which will include first dose of Pfizer and also second dose, and also the one dose of J&J vaccine. So indeed, we're very pleased with the fact that we are remaining over 200,000 and approaching 250, and hopefully very soon reaching the target set by our president of 300,000 vaccinations per day. I must acknowledge that we did have a dip in the last week where we had a shortage of a supply of vaccines, but I can assure members of the public that this has now changed. Over the last few days, we are very pleased to inform the public that our vaccine supplies have now stabilized. As we speak to you this morning, we have over 10 million doses of vaccines in our storage, in our fridges. In August alone, we expect to receive by the end of in the month of August, when August ends, we will have received over 20 million doses of vaccines. So the supply of vaccines has stabilized, and for the remainder of the year, we expect to deliver another 21 million doses of vaccines. This means that the vaccination program can be expanded sufficiently to reach more people and can be accelerated to cover more and more of the population. We will give some more details in the coming week. For today, just to give the highlight and to assure members of the public that indeed we are stabilizing over the next August. We're very satisfied that we will not get any instability in terms of the supply of vaccines. So we can assure everybody in that regard. I can also just add that in our last National Coronavirus Council meeting, our Vaccine Ministerial Advisory Committee did make a presentation, and following that discussion, the NCCC, on behalf also of the Interministerial Committee, which did not sit this week, will be sitting next week. After that presentation, it was also approved that within our arsenal, we must also include the Sinovac vaccine, which has been conditionally approved by the South African Health Product Regulatory Authority, but also that the AstraZeneca vaccine, which have now been shown to be effective against the Delta variant, that we should also look at bringing it back into use. And of course, there is some work which will need to be done in terms of the regulatory aspect of the AstraZeneca vaccine. So I want to take this opportunity to assure South Africans again that these vaccines, which are being approved by our regulatory authority, have been tested and have been found to be safe and effective, especially against serious illness. We want to emphasize again that there is no claim by any scientist, any one of us in the health leadership, that once you have the vaccine, you will never get COVID-19 infection. What we are assuring the public is that, and it's proven, not only in South Africa, but all over the world, that people who are vaccinated, in 99% of the time, they will get, even if they get the virus, they will get a mild disease. If they do end up in hospital, in most cases, they will not end up in ICU getting serious illness. So these are the things which have been tried and tested over the last 8 months or so all over the world and also in our country, just to assure you that indeed already, as the members of the public will know, that we started our vaccination program with our healthcare workers. And the report, which I'm sure when Professor Glenda Gray speaks, it will indicate that indeed, after that Sisonke Jnj vaccination of healthcare workers, what we can see already is that in this third wave, everywhere we go, even without proper studies, just from the reports of the health workers themselves, the leadership of healthcare, that this time around, very few healthcare workers have been falling sick, very few also have been admitted to hospital, very few have ended up in ICU. The breakthrough infections do happen, as I've emphasized, that no one has actually claimed that nobody can be infected after having a vaccine. I want to again call upon all our 60+ citizens to come forward to get vaccinated, the 50+ also to come forward. As you know, we are now over this month also registering and vaccinating the 35+. We also call with this cohort to come forward. We're encouraging you to come forward before the end of August, because from the 1st of September, as you know, President Ramaphosa did announce that from the 1st of September, the 18+ will also be registering and vaccinating. But as I conclude, I want to again just remind South Africans that as we do all these measures, as we put up our facilities to make sure that those who are infected can be isolated, they can be quarantined, those who are sick can get medical attention, the more reliable ways of protecting ourselves remains the non-pharmaceutical interventions, the tried and tested, social distancing, washing the hands and sanitizing, wearing our masks when we are in public, making sure that we keep away from crowded places. These are the tried and tested prevention measures, and we want to call on everybody to remember this. Now, before I give back to Mr. Baloyi, let me just again thank our healthcare workers, our frontline soldiers, who on a daily basis are out there saving lives. Many South Africans, we know we have lost many lives every week, friends, colleagues, family members succumbing to this virus, but many more are being saved. And we must continue to thank our gallant healthcare workers in the front line for saving many lives. Thank you very much, and back to you, Mr. Baloyi.
Thank you very much, Minister Dr. Joe Phaahla, the Health Minister of the Republic of South Africa. Thank you very much for the overview across the country, but also to thank you very much for the emphasis on the containment measures in place, but also for reminding us about the basic principles of masking, hand washing and sanitizing, and social distancing, but also for making the call again for the designated age group to make a trip to the vaccination center. Thank you very much, Doctor. The program will be run like this. We are going to have the release of the Sisonke study results on effectiveness of the J&J by Professor Glenda Gray. Then she will be followed by Ms. Jackie Mayman on the role of community pharmacists in the vaccination rollout. And then we are going to have Dr. Anbai Pillay, who will be taking us through the epidemiological trends report. Then we'll look at the public dashboard enhancement demo by the EVDS team. That will be led by Mr. Wesley Solomon. And we will go to the Q&As before calling the Director General, Dr. Sandile Buthelezi, to make closing remarks. On that note, let me welcome Professor Glenda Gray to take us through the release of the Sisonke study results on effectiveness of the J&J. Thank you very much, Prof.
Thank you very much. Are you able to see my slides?
Yes, it is visible, Prof, from our side.
So thank you. I just want Linda Gale, would you like to show your face? So Linda Gale and I were the co-leads to lead the Sisonke study. So I'm presenting this on behalf of the team, but also on behalf of Linda Gale Becker as well. So I just want to show my appreciation to the hard work that everybody put in. So Linda Gale, keep your video on. Thanks. And maybe you can say a few words afterwards. So on behalf of the study team, we want to give you an update on the Sisonke study. So just to give you some background, we started the Sisonke study around about the 17th of February when the national rollout faltered, and we were able to give healthcare workers vaccination in time for the third wave. So this phase 3 open label study was started once we knew that the J&J vaccine could work in a phase 3 trial, and it started when the national rollout faltered. And in being able to do this, we were able to get healthcare workers access, and we are now able to provide effectiveness data both on the beta and the Delta variant of concern and show you whether this vaccine is effective or not on them. And also to provide additional safety, because at the time when we rolled out the study, only around 25,000 people had been exposed to the A26 vaccine. And so we knew a little bit about the safety, but this was an ability to give us more expanded safety data. So just to remind everybody, we completed the formal phase of the Sisonke on the 17th of May, 2021. We were able to reach 120 sites all over the country, and both in the rural and urban areas of South Africa. We were able to take mobile units into rural parts of the Eastern Cape, Northwest Limpopo and Mpumalanga, as well as the urban settings of the metropolitan areas. And we were in this program, we were able to vaccinate just under 480,000 healthcare workers. So when we look at the analysis for the effectiveness of the A26 vaccine, we obviously want to look at the infections that we get, and we will get, as Minister said, we will get breakthrough infections, and we want to make sure that we understand whether these breakthrough infections were mild, moderate, or severe. To look at the effectiveness of the vaccine, we've used 3 data sets, and I'm going to report on the data sets from 2 of the 3 programs. The last one is outstanding, and we hope to get the last analysis in the next 10 days or so. And 2 came from medical insurers, and 1 came from a provincial PERSAL database, where the PERSAL is the payroll database of the government, and we used the Western Cape PERSAL database. To make sure that we were consistent in our findings, we used between 2 and 3 different analytical methods, and to make sure that there was consistency. And today we report on the 2 data sets that we have evaluated. So when we look at the evaluation of the effectiveness, we start looking at the vaccination protection after 28 days after receiving the single dose J&J. And we closed our analysis for this on the 17th of July this year, in the middle of the Delta wave. And the reason why we closed the first analysis at this time was because healthcare workers were getting anxious and were worried that the vaccine may not be protecting them. And so we will continue to have ongoing analysis of the Sisonke study up to 2 years, and we'll be able to see how durable and effective this vaccine is over time. So just our first headline result is around vaccine effectiveness against death. And so looking at the data set, we can report that the single jab J&J vaccine protected between 91 to 96.2% of healthcare workers against death. The Kaplan-Meier graph that you see in front of you compares the vaccine group, which is the fat line at the bottom of the graph, as compared to the control, which are the people who are unvaccinated. And you can see that consistently after receiving the vaccine, there's very little impact. There's very little deaths that are occurring in the vaccinated group as compared to the control group, and showing a remarkable up to 96.2% protection against death. So this was our primary endpoint, and we were able to say that this vaccine protected healthcare workers against death. We then look at whether this vaccine protected against the Delta variant of concern. When we started the vaccine implementation study, we knew that we had the Beta variant of concern circulating in our country. And then over time, the Delta variant of concern replaced the Beta variant of concern. And here you can see on the left is the period of time when Beta was circulating, and on your right, the period of time when Delta was circulating. And you can see this is around hospitalization. And in these two Kaplan-Meier curves, you can see quite profoundly that the vaccine protected both against Beta and against the Delta variant. And if you look on your right where the Delta variant of concern is circulating, in fact, the impact is greater, and we see better efficacy against Delta than against Beta based on this analysis. So I'm going to give you five take-home messages. I'm going to tell you first of all that the J&J vaccine prevents against hospitalization and death, and these are the results from two data sets. We saw between 65 and 66 protection against hospitalization, and we saw between 91 and 95 protection against death. When breakthrough infections occurred, they happened to be very mild, as the minister mentioned. Around 96% of breakthrough infections are mild in the healthcare workers, and in terms of severe and death, these have been less than 0.05%. Both death and severe infection like ICU admission. So the take-home message here is we do see breakthrough infections, and these are mostly mild. The third message I want to give you is that protection is good against both the Beta and the Delta variants. And as you've seen, we showed you that it's about 67% protection when Beta dominates, and about 71% protected when Delta dominates. And this is a very important message, that the protection is good and probably better against the Delta variant as compared to the Beta variant. And then fourthly, we want to tell you that the J&J vaccine is safe. There's no safety signal that we detected in this cohort of people or at a global level. The side effects that we see are completely in line with what we are seeing globally. We have seen some rare adverse events that have been reported at a global level. You only see these rare events once you've vaccinated millions of people, and we've seen two thrombocytopenic thrombosis syndrome, and both have made a complete recovery. And we continue to evaluate the safety of this J&J vaccine, and we will continue to evaluate it for a further 2 years. And then fifth, based on the data that we showed you now, and data coming from laboratories from overseas, we can show that the vaccine shows good durability, and that given the 65% protection against hospitalization in the 20 to 90 days post-vaccination, and the 65% protection against hospitalization in the 90 to 120 days post-vaccination, we do not believe that there's a need for a booster at this stage, and we will continue to evaluate this as we follow up the healthcare workers in Sisonke. So in conclusion, Linda Gale and I and the Sisonke team provide the world's first evidence that the A26 COVID-19 vaccine is effective against the Delta variant of concern. We show you that the vaccine works very well in South Africa and protects against severe disease and death. All the immune responses that we've seen indicate good, immediate and sustained immune response against Delta. And we see surprising durability in the immune response for up to 8 months. We provide the global real-world effectiveness data that the Sisonke vaccine worked as well as we saw in the randomized clinical control trials called Ensemble 1. There's a lot of people that we need to acknowledge, and the amount of acknowledgements is almost as long as the slide set that I showed you. But we have to thank the J&J and the US government who co-owned these vaccines and donated it to South Africa. And we have to thank the South African government for funding the vaccine trial, particularly the Treasury and the National Department of Health. And we have to thank the NAT Joint Security Cluster for moving our vaccines all over the country together with BioCare. Very important to acknowledge BioVac, who received the vaccines every night and packed through the night so that we could deliver the vaccines at 4 o'clock in the morning. So I want to thank them, and Leonard Lazarus, who made sure our vaccines were safe. We have to thank our funders and our US collaborators and the study team, which is huge. You can't do this study without having a team of people that support you in every part of the way. And I also want to just acknowledge Melanie and her team. The electronic vaccine data system is a beautiful tool and has helped us to try and analyze this data. So I just want to thank Melanie, who's on the call today, as well as the various other people in RCD, MRC, CRISP, the safety team, the people who looked after our safety, and the people who supported the data analysis. I want to thank everybody for helping and assisting and working tirelessly over the last 4 months. Most importantly, I need to acknowledge the investigators of record. These sites took their teams and went all over the country to deliver these vaccines to the healthcare workers. So I want to acknowledge them, because without them, this work would not have been done. I want to thank the Western Cape government for providing data on the PERSAL, and particularly Andrew Bull, Reshma, and Mary and Davis. Thank you very much for all the hard work that you've done. And then to acknowledge the discovery team that also worked with us to provide the data that I've just showed you on the Delta variant of concern and the Beta variant concern, and the data on deaths. I'm going to end here. I'm just going to ask Linda Gale just to say a few words in case I've missed something, but just want to thank our staff, the healthcare workers, our partners, funders, and government, and the huge privilege that we had to deliver this vaccine study to the country.
No, thanks, Glenda. I think you've done a brilliant job. I'm sure there are going to be lots of questions. I would just add my thanks to our colleagues, the healthcare workers, who so enthusiastically stepped up to be vaccinated and who have continued to provide data to us in terms of any side effects they've had, any difficulties they've had, and any breakthrough infections. We encourage them to continue to stay in touch with the safety desk so we can continue this evaluation. But thanks for doing this for us today, and thank you for your leadership. We've appreciated it all the way. I'm sure we can take questions after the presentations.
No, thank you very much, Professor Glenda Gray. Thank you very much, Linda Gale Becker and the team, especially on the conclusions that you have come across that will assist us a lot when we're dealing with the issue of vaccine hesitancy, but also the myths around that, and also the concerns on the adverse events of this. I think that's quite insightful. Thank you very much. Let me then welcome Ms. Jackie Mayman on the role of community pharmacies in the vaccination rollout. Thank you.
Good morning, and I'm just going to hopefully put my slideshow on. Good morning, everybody, and especially to everybody in South Africa. So the Independent Community Pharmacy Association looks after the interests of 1,230 community pharmacies across South Africa, and obviously all the community people that we look after. So vaccinations through pharmacy. With the arrival of the first vaccines in South Africa, Pharmacists as custodians of medicines and experts in cold chain management were pretty central to the vaccine supply chain. Pharmacies serving their local communities joined the rollout program in the largest public-private partnership ever seen in South Africa. And with our primary healthcare clinics, pharmacists and nursing sisters, we are ideally positioned to offer COVID-19 vaccinations in our healthcare settings. So go and ask your pharmacist. We're accessible healthcare professionals. We're available long retail hours, after hours, and over weekends. We offer advice over any vaccine concerns that you may have, any questions around comorbidities or chronic illnesses, and of course worries over any potential drug interactions. Pharmacies have remained open through hard lockdown and put effective infection control measures in place to keep people safe. As a vaccine site gets ready, there are a number of processes that take place. It's complex, and with numerous stops and checks. Firstly, there's curation by the South African Pharmacy Council. We require a permit from the National Department of Health. There's training for COVID-19 vaccine injectors. There's site readiness checks, registration of sites on the electronic vaccine data system and the stock visibility system. Of course, there's the ordering of all the consumables, the correct syringes, needles, diluents. Safe disposal of medical waste is critical. Implementation of strict infection control protocols, and then the ordering and cold chain management of the vaccines themselves. And all of this put together is intended to ensure a safe vaccination environment for the public. As we process vaccinations, a number of other measures are put in place. So all the vaccinators and administrators are checked, their registration status, their training before they are registered on the EVDS. Stock is received, cold chain is checked, the stock is put directly into freezers or fridges, and that stock is then uploaded onto the SVS, which monitors usage and stock levels. Fridges in pharmacies have got 24-hour monitoring devices, and temperatures are checked and recorded twice daily, every day. Vaccines, once they are defrosted, may not be refrozen, and they must be used within the efficacious time frames. The day of vaccination, vials are brought to room temperature. Any reconstitution is done. The vials are monitored and used within the new time frames. Every step in this process is monitored and recorded to ensure that the vaccines are not compromised and that they are effective at the time of vaccination. So we've been taking vaccines to the people from the beginning. We've been involved with many outreach services. These are to retirement villages, old age homes, mines, factories, workplaces, businesses, and SASO grant lines. Equitable access is very important to us, and pharmacy sites accept any eligible people. So at the moment, that is anybody over the age of 35. These could be scheduled by the EVDS. They could be appointments done with the pharmacy themselves via phone, email, or WhatsApp, or they could be walk-ins, vaccine and slots permitting. Pharmacies accept both insured and uninsured with SAID documents or passports at no cost to the person. And I want to emphasize that any person that comes into a vaccination site pays nothing. So on the 17th of May, ICPA started its vaccination rollout with just 2 sites in Gauteng. Ackermans and East Park pharmacies were our pioneers. And I can tell you that now, after that very shaky start, they provide 1,200 vaccinations every day. The next week, on the 24th of May, we rolled out another 25 sites, mostly rural, Lapalele, Tapazimbi, and each week we added more Pfizer sites. This week, we are really excited with the arrival of Johnson & Johnson vaccines in the private sector. And these really have moved into the areas that are underserviced and rural, such as Giani, Tabanchu, Mamelodi, Khayelitsha. So if we look at the pharmacies that have been onboarded, so the total number of sites that we have that are currently vaccinating are 324. Our average vaccinations per site per day is 99. Total sites with permits and ready to vaccinate is 588 pharmacies. So we've got 264 sites in our pipeline. 55% of our sites are ready or vaccinating at the moment. And our site capacity is just over 30,000 per day. Once all our sites come online, we will be able to vaccinate about 50,000 people every day, which is 1 million people a month. We're very proud of that. But it's not just the independent pharmacies. This comes from the Pharmacy Council register. We've got 3,599 community pharmacies across South Africa. And with these include the corporate pharmacies who are also providing vaccinations. We are also very keen to work with general practitioners and doctors. They are eagerly waiting to come online, and many of them will be working together with pharmacies. Of course, vaccinations are also given via hospitals, occupational health sites, and as the Minister already indicated, in the private sector, we are working towards offering 1 million shots every 3 days. So what's the experience? Well, I can tell you, every single site has the same experience once they get going, and that is one of hope and positivity. The patients and the members of the public who come in to be vaccinated are wonderfully full of gratitude. We've had millions already vaccinated, as the Minister indicated. The 35s and over are registering and arriving with their parents, grandparents, neighbors, friends, and this is a wonderful thing to see. 18s and over are already phoning to book, ready for the 1st of September. And we really welcome the opening up completely, allowing anybody over 18 to be eligible. As the Minister said, there's a large supply of vaccines secured for the foreseeable future. And we're very pleased to say that we're busy negotiating a smaller pack size of delivery of vaccines, which should allow the smaller rural pharmacies and GPs to join the program. And I really want to just emphasize to everybody, every vaccination has the potential to save lives. Thank you very much.
Thank you very much, Ms. Jackie Mayman. I think it's all hands on deck, public-private partnership, very important. Let me then invite Dr. Anban Pillay to give us the epidemiological trends report. Doctor?
Good morning, Minister, DG, colleagues, chairperson. I'm just going to put up my slides. Hope you can see them.
Yes, we can see them.
Thank you. So I'm going to cover the epidemiological profile over the past week, as I've done last week. You can see from the report of the PCR and antigen tests across the country that we have passed the peak of the third wave. This is in the graph on the left-hand side. You can see that we're on a downward trajectory. Having said that, though, I think we need to bear in mind that at this stage, we're sitting with a positivity rate of 25.9% plus minus, which means that 1 in 4 tests are effectively positive. That gives us a sense about the spread of the infection across the country on average. If we look at the provinces and the profile across each province, the good news is that Gauteng is continuing to decline. That's represented by the red line, and we're hoping that this trend continues. On the other side of things, we can see that the Western Cape is steadily increasing, as the Minister indicated. The Western Cape has now surpassed Gauteng in terms of cases. A similar trend is appearing in the case of KwaZulu-Natal as well. The other provinces at this stage don't show those kinds of increases. I'll go into detail relating to each of the provincial updates now. In the case of the Eastern Cape, you can see quite significant increases in the Nelson Mandela Bay Metro, as well as Sarah Baartman. On the left-hand side, these two curves representing these districts. On the right-hand side, you get a sense about the hospital admissions and the beds that are available. and we've categorized those into moderate, high, and very high. And you can see at this stage in the Eastern Cape, we're looking at moderate levels of bed occupancy. So the infection hasn't spread to the same extent as it has in the Western Cape or KZN, which I anticipate is good news, and we hope it stays that way. In the case of the Free State, you can see that each of the districts here appear to continue to have increases in the caseload. And on the right-hand side, when you look at hospitalizations, you can see after the second wave, while they did have a decline in cases, but that was for a very short while, and the third wave basically came through quite quickly and appears to be sustained, and the Free State hasn't actually got out of a very high level of bed occupancy over this period, and it continues to be that way for quite a while now. Coming to KwaZulu-Natal, here we see that the number of cases for a while we were not sure about because of the unrest in the province, but it's now starting to increase again as a result of the testing data coming through, and we're seeing that eThekwini as well as Zululand districts are showing increases. We can see that the hospital admissions in the province are in the moderate zone currently, which is good, and we hope it stays there. So there's certainly space in the hospitals currently. There are several clusters that are contributing to the upsurge of cases in the province. Compliance with the regulations are important. There have been a number of protests across the province, and that does contribute to as super spreader events. So we do urge that those that participate in those activities to bear in mind the impact that these types of activities have as super spreader events. In the case of the Northern Cape, you can see on the left-hand side that the majority of the districts are showing increases. You can see that ZFM, the Francis Bart, as well as Pixley Kaseme, showing the highest numbers of cases here. The hospital admissions in the province are currently very high, very much like the Free State. They didn't really come out of the second wave for any significant period, and they've been stuck in the third wave for quite a while now. It appears that funerals are a big contributor to the high numbers in the Northern Cape, as well as social events that are a big contributor as well to sustaining the numbers that are continuing to occur in the third wave. Going to the Western Cape, all of the districts in the Western Cape are showing increases. The biggest increase is clearly in the Cape Town metro area. Hospital admissions are currently very high. You can see that the Western Cape is sitting in the red zone with high case fatality rates as well. The household, workplace, as well as congregate residential settings are contributing significantly. The recent taxi violence has resulted in increases in cases as well, due to people being immobile as a result of that occurrence, as well as a decrease in the mobility of people. So it's difficult to say as to whether the Western Cape has passed the peak as yet. I suppose in the next few days, the data will tell us as to where we are. Looking at the weekly percentage positive, you can see across a number of provinces, we are seeing declines, which is very good. Limpopo and Mpumalanga are showing declines, Gauteng as well, and the Northwest. On the other hand, the KZN province is showing increases in terms of the percentage positive. The Free State is fairly flat increases in the Northern Cape, the Eastern Cape as well, and the Western Cape. Currently, the percentage positive, as I indicated, is sitting at 25%. We'd like this number to be right down below 10%, so we're very far off from that at this stage. Look, comparing our hospital admissions as well as deaths over the past 14 days with the previous 14 days, generally speaking, there have been declines in the hospital admissions across provinces, except the case of the Western Cape, as I indicated. And as we know, as the number of cases a decline. The hospitalizations take a while to come through in terms of declines, but we're seeing those declines here, which is good. And deaths continue to follow that trend as well as the last indicator. But what's good to see is that in most provinces, there are declines in deaths, except the Eastern Cape, KwaZulu-Natal, which is showing increases, the Northern Cape as well as the Western Cape. And those are the provinces that we need to manage the transmissions much better. Looking at the forecast going forward for the week and a bit by the modeling team, very clearly there are good declines in the case of Gauteng. However, in the case of Free State, we're going to see some increases. It's predicted the Eastern Cape as well is going to have increases, KZN as well. In the case of Limpopo, we're going to see declines in numbers. The Mpumalanga province is also going to show declines. Western Cape is continued to increase quite significantly, actually, from the prediction. Northern Cape as well is showing increases and a good decline in the case of the Northwest. The weekly hospitalization prediction and forecast as well, in this case following very much the trends that we're seeing in the case of the number of cases across the province. And we can see that Gauteng has got out of the red zone. It's currently in the high admission load. Similar in the case of the Free State. The Eastern Cape is still in a good space in terms of hospitals. So is KwaZulu-Natal. Limpopo is showing declines and it's come back to the medium level occupancy. In Mpumalanga is still very much in the red zone, which is worrying. And then the Northwest and the Northern Cape as well as the Western Cape are continuing to be in this zone. Thank you very much, Chair. I'll stop there.
Thank you very much, Dr. Anban. I think the trend shows that it is still in our hands to arrest the spread of the virus in terms of our behavior. Thank you very much. Let me call upon Mr. Wesley Solomon to give us the public dashboard enhancement demo with the EVDS team. Mr. Wesley.
Thank you, Honourable Minister, Dr. Joe Phaahla, DG, Chairperson. I'm to present, along with Ms. Melanie Wolmerans, the enhanced dashboards. As part of this presentation, I will need to do a quick refresh of the pages that are already on the dashboard. But we'll focus on the new pages and the enhanced features that you can now use. This is a live presentation, so those of you who can multitask successfully, you are free to navigate to the SA Coronavirus website and follow along with me as we go along and click through. So it's sacorona.co.za, and you navigate to you move your mouse along the cursor till you get to the vaccine updates tab, and there afterwards you scroll down and select latest vaccine statistics. So those of you who have your devices ready, we'll also provide some insights along the way. Presentation. First page that you land on. So there are many pages of this dashboard. The first page is what we call the disclaimer section. In the disclaimer section, it contains the most important definitions and rules that describe the data. But here are some of the highlights. Only data captured on the Electronic Data Vaccination System, the EVDS, will be displayed. The data is updated every 24 hours between 6 and 7 p.m. So if you're looking at the latest updates, come check in after 7. Paper records that are not back captured yet are not included in these figures. It's important to note. The next thing I want to bring your attention to is look carefully at the definitions that are included, that include the vaccinated and fully vaccinated individuals, as well as we indicate what the sources of the data are. I'll bring your attention to some of the specifics as we move along and review the pages. So the next page is page 2. This you've seen already. It shows us the total number of vaccines administered in the last 24 hours, recorded as 181,000 vaccinations. There are two graphs. The graph on the left breaks down the total number of vaccines administered per province, and the graph on the right further disaggregates this between public and private to see the level of distribution. The next page is page 3. This page reflects the total number of vaccinations. Sometimes we call it the cumulative number of vaccinations. You'll see the graph goes upwards as you move along. And I want you to take note of the number, 8.3 million. It will be relevant later on as we show you enhancements. You can hover over the left at any of the trend line points, and you can see the total number of vaccinations that were administered on the day. And the graph on the right shows the total or the cumulative number of vaccines administered per province. You will note that Gauteng has the highest number of vaccines administered, recorded at this point, with just over 2 million. Page 4. In our program, currently, we have 2 types of vaccines, namely the J&J, Johnson & Johnson, and the Pfizer vaccine. This dashboard's purpose is to display the number of each of these vaccine types that were administered in the last 24 hours. Because Pfizer has 2 shots that needed to be administered, the provincial breakdown specifies if in the last 24 hours people have received their first or their second dose. Let's break this down. For example, in Mpumalanga, of the 4,200 people that were given Pfizer vaccine in the last 24 hours, 2,700 received their first dose and 1,500 received their second dose. On the far right, you will see a section entitled Fully Vaccinated Individuals. Now, this is part of the definitions that I mentioned up front. These are individuals that have received the J&J vaccine or both their first and second dose Pfizer vaccines. As we know, this number should be a little bit lower than the total number of vaccines administered because it takes into account this fact. So 100,000 have been fully vaccinated as in the last 24 hours, which is an achievement. Page 5. This aggregates the total number or the cumulative number of vaccines by vaccination type, which for the J&J vaccination program, we split it up between those that were done during the Sisonke trial and those that were done, J&J vaccines that were administered during the national rollout. And with the Pfizer vaccine type, we split it as of the previous sheet to know how many first doses were the first dose, how many constituted the second dose of Pfizer. So this concludes the revision of the current pages. So let's slow down and let's take a look at what's happening and what's new. So the first thing we'll want to bring your attention to is the total number, the 8.3 million. You'll see that these pages now that I'm going to show you gives you additional functionality to explore the data that we already have in ways that you can disaggregate and shift views for specific items and areas you're interested in. The main display is a line graph. It's a visualizer that we can either toggle between the number of vaccines administered per day per province. If you look at it right now, you'll see that it looks like a leapfrog effect jumping up and down, and that's commensurate of the decrease of vaccinations that occur on weekends. And the second part is you can toggle this very same information, and here's the word cumulative again, and we'll see the total or the cumulative number of vaccines that have occurred. You'll notice that what we're looking for here is a steep gradient of the curve, an increased gradient, which means the level of effort has improved, accelerated. So let's give some time to orientate over what the additional features. It's important that we take some time with this because these features are continuing throughout the rest of the enhancements. Firstly, you can now select one or more provinces and restrict your data analysis. Once you've selected the provinces, the data on the visualization will change to just reflect those provinces. Once you are done and you've completed your analysis or want to look at a different province, you can either select all, or there's a handy button on your right-hand side called Clear Filters. Just clear filters, and then you're back at the start. In addition, you're able to select the vaccination period and look at the data in a specific period at a time. So let's look at this in an example. Let's first apply the filter search with the age, with the vaccination period, and let's put the period from the 1st of July until current. When you do this, we just have to scroll down a little bit because the vaccination program has been for a while. We click on the 1st, and we'll see that the data changes. Now you can see very pronouncedly the effect of the weekend vaccination reductions. But let's take a look a bit further. What happens in a specific province? So let's go back to the province select tool and let's select Gauteng. And as we select Gauteng, we'll see that only Gauteng level is there. Now hover over any of those points and it tells you on every specific day what number of total vaccinations have been done and what's the split between the vaccinations that were done in the private health sector or public health sector. Now, that's one side of things. We'd love to see this contributions in a trend line and see what happens weekly. So we can select only public health sector in the next health selection tab, and you'll see the graph changes slightly. Once you're happy with that, you can select private health sector, and you'll see the distribution and contribution to the overall trends. That's the idea of this first sheet. So let's clear filters and let's move on to the next enhancement, page 7. So please note, before we dive in, as I mentioned before, the select province and the date restriction feature is consistent and behaves exactly the same way in this graph. If you look on top again, it's looking at the total number of vaccines administered, which is 8.3 million. So once again, it's giving you a different way to analyze and explore the data. The purpose of this particular dashboard is to focus on two factors: the age band distribution, which is located on the left-hand side, and it is congruent with the South African vaccination rollout strategy, and the effect of the sex distribution, being females in yellow and males on green. The two data graphs of the population pyramids on the left are displaying the same data in two different ways. The one on the far left displays the crude numbers, which you're able to look, 2.7 million compared to 1.7 females to males, which are over 60s. And on the graph adjacent to the right, you're able to see the same data expressed as the percentage of total vaccinations. As we move over to the graph on the right, you'll see a stacked bar graph indicating the proportion of the age groups that have contributed to the cumulative number of vaccinations administered. What is important to note about this is that if you look at the age band strategies, the over 35s to 49s, which is indicated in red, has, even though it started out later than the over 50s to 59 age category, its proportion of contribution has been is higher. So it just shows the uptake rate of the age groups from 35 to 49. Let's review some of the high statistics right on top, which is showing the percentage individuals males vaccinated compared to the percentage individuals females vaccinated. And we'll see that there are many more females that have been vaccinated at 60%. But if you take a look at the population pyramid, you'll see that this is largely skewed by the large number of over 60s females that have presented for vaccination. Last thing to note over here is that we'll see some age groups that are below the over 35 age group, and that's generally because those were captured during the health priority sector groupings rollout. Page 8. Up until now, the pages have been focused on exploring data related to vaccinations administered, and this is an important definition to speak about. This page considers that the fact that some people have received their second dose of Pfizer, and when you account for this, we can actually account for how many individuals have been vaccinated. So we control for the number of, the previous plot was the number of vaccines were actually administered, and then we say how many of those vaccines were administered to the same person. So it's very important to note the definition at the bottom over here. So the first thing you'll see, the first time we've introduced this new number of 6.6 million that have been administered. The rest of the graph and the analysis is pretty much the same what you've now become accustomed to. The split between the vaccination manufacturer types of 1.7 million for J&J compared to the 4.9 million for Pfizer. And you'll see a line graph indicating the trend of vaccinations per day. So once again, this is not cumulative, this is the number per day. On a whole, we'll see that general incline of the stability of the vaccinations, and yeah, the daily fluctuations do occur. Let's move to page 9. Now that we have got the grips of knowing, so the number of unique individuals that have been vaccinated, that's 6.6 million that we received, we can start orientating these results to have an idea of coverage. So to get the idea of coverage is to know how many people you've reached, you need an adequate denominator. And for this case, we use the 39.7 million, which is part of the Stats SA 2020 population mid-year estimates. They are focused on the 18 years and older, the adult population. And when you start taking that 6.6 million and reviewing this data in context of the total adult population, we see that we have a coverage of 16.8% currently of number of individuals vaccinated in the country. The two graphs below start demonstrating this. The one on the left starts orientating this results as far as a provincial view. And when you're doing this, you can start seeing that certain provinces, Eastern Cape, Western Cape, and Western Cape have already reached over 20% coverage, with provinces of Limpopo and Free State hot on the heels, almost reaching that threshold, which is quite impressive. The last part is if you prefer to read this data as a tabular format, it's over here on the graph, which indicates both the numerator and denominator clearly and how we derive those statistics. Before I hand over to Ms. Vormerans to see if she wants to add anything, these enhancements we just want to indicate are made possible because of communication from what we hear and what we are asking on, what we receive our needs. So we request that the community engage with this dashboard. It's public, it's there for you to use. And we continue looking at ways of improving this platform, which we are doing currently. So we encourage regular engagement and we look forward to your feedback. On behalf of the national provincial teams, from both the public and private health sector that capture and make this data possible, I thank you. Ms. Vormerans, would you like to add anything?
Thank you, Wesley. I just want to briefly talk about the registration summary. Everybody will notice that we have got this under review, and this is as the maturity of the program is unfolding. We now have different means of how people can register. We should be, by the end of next week, bring registration data back into this after we have completed the review and being able to present to you that information into a form which you can then digest and understand. Thank you very much.
Thank you very much to the team for the good presentation of the graphic representation. I think the graphic presentation can act both as a barometer and also a roadmap, and can also be used as a management tool. Thank you very much. Allow me, ladies and gentlemen, now to open up for questions that have been sent, and others are continuing to be sent. I will also invite Deputy Director General, Dr. Nicholas Crisp, and also the EVDS Project Manager, Ms. Milani Vormerans, to be part also of to join the panel when we deal with questions. Let me first start with the very first question. I think the question it's from Newsroom Africa, Andy Swa. She says, the results on the Sisonke trial effectively has implications for those who have taken the J&J jab. Can we please ask, has the study shown how long efficacy actually lasts? That is the first question. I'll take first a set of 5 questions, and then I'll go to the other questions. There is a question from Dr. Akhtar Husa, who says, post-vaccination death, any reports? There is also the third question is from Karen, who wants to know, how do you prove that you have had the vaccine? Surely the card that you receive when it's not acceptable because it is easy to be copied. I think she wanted to say the card that you receive can easily be copied. The fourth question is from Matilda. It says, the 5% who demise after being vaccinated, what are the probable causes? Let me take the last one of this batch. has the issue of prior vaccination against adenovirus reducing efficacy of the Jnj vaccine been looked at in your studies? Thank you very much. I think the questions can be shared among the panelists.
Okay, I'll start and I'll ask Linda to also follow. Thank you for the questions. So let me start off with adeno 26. So we have been following up people who have had adeno 26 prior infection, and less than 25% in South Africa have had adeno 26 infection. And we have a paper that's been submitted to the journal looking at this, at the impact of prior adeno 26 on vaccine efficacy. And just the top level results is that there's no impact on vaccine efficacy due with prior adeno 26 vaccine, prior adeno 26 virus infection. So no association between a reduction in vaccine efficacy and had been infected with adeno 26 before. In terms of the post-vaccination deaths, every person who in Sisonke who died within 28 days of being vaccinated, we did a full post-mortem on to evaluate whether there was any association with the vaccine and death. And we also compared it to background death rates in both men and women and different ages. And we did not see any safety signal around the vaccine per se causing a death. We saw 2 rare clotting disorders, and they weren't fatal. We were able to manage them very carefully, and so we continue any death that occurs in the last 28 days of a vaccination needs to be fully evaluated. And I think the minister last week said this, that you need to alert the health authorities for any vaccine that has put death within 28 days, so we can evaluate what the reasons for the death was. But the people aren't dying at any higher rate in South Africa as compared to at the global level. And at a global level, there's no safety signals on the vaccine. So I think we continue to monitor. These vaccines have been given to now 40 million or more individuals at a global level, and and with the Pfizer around a billion. So we have a good idea of the safety of these vaccines, but it's always important to evaluate the local thing. In terms of the durability, we will continue to evaluate the durability. The ensemble study, which we based our Sisonke vaccine trial on, data will be available now at the end of August. That has been following up people for over a year. So we'll have data on durability, but in vitro work in a laboratory that's followed up people in the phase 1 trial has shown good immune responses even up to 8 months. And so we have no reason to believe that the vaccine has waned in its effectiveness. However, it's important to continue to follow up people in terms of the immune response to make sure that we have a readout on vaccine effectiveness. And we'll be able to do this serially because we'll be following up all Sisonke participants over 2 years. Linda Gale, is there anything that I've missed in terms of what other questions that I don't know if you want to add anything?
Maybe just to remind those who are on the press conference that there is an additional in-depth sub-study underway with Sisonke, 1,000 healthcare workers, some of them living with HIV and with comorbidities, that will be following up very carefully with immunological studies as well. So that data will be coming. Thanks.
Thank you very much to the panelists for the response. We have other 2 questions. It's a question for Glenda Gray. It's from Ground Up. They say, who was in the control group in each of your studies? The second question, maybe if I can take also this one, Prof, is from Kuda Magwedere. It says, if the vaccine has 67 and 71% protection, has there been an exploration as to the underlying factors or risk factors in the 29 to 33% who are not protected? Does previous vaccinations for other diseases have an effect on the effectiveness of the vaccine response? Thank you.
So thank you. So those are very good questions, and I'm going to also ask Linda Gale to chip in. So in terms of the issue of the control group is a very important question, and at a global level, the methodologies that we apply when we roll out a vaccine when it's not in a randomized clinical control study. So when we roll out an implementation study, we give vaccines to everybody, and there's no one who gets a placebo. And so we have to figure out at a global level methodologies that will show us how to do this. And this has been done before in how to measure effectiveness of influenza vaccines. And so we use the global methodologies. And the first methodology that we used was what we call a clinical twin, which is a matched pair cohort analysis, where we match a vaccinated person with its clinical twin by age, district, comorbidities, where they live, and other factors, and we match them, and we match these clinical twins, and then we look to see the relationship between those who get vaccinated and who don't, and what happens to them in terms of SARS-CoV-2 and other infections. So this is a well-described methodology, and if you the NEJM Israel study will show you some of the methodology, and once we publish this, you'll be able to see our methodology on this. But essentially, we have a clinical twin that we match on everything to see whether there is protection. And then there's the test negative case control design, which we use mostly for influenza vaccines. And this is what, at a global level, a lot of people use. So we use both methodologies. And this is how effectiveness has been reported for other COVID vaccine trials. And basically, you need to know, this is a pathology-based ascertainment, and you need to know the SARS-CoV-2 data and the timing, and you look at it over time. And then in the third analysis we did a cohort analysis of time-varying vaccine exposure using the Cox proportional hazards. So all of these methodologies are well described and well validated at a global level, and when we publish the data, these will be available for scrutiny. In terms of the protection, so when we evaluate a vaccine, we evaluate it, and for an individual person, if you get a vaccine, you have between 90 and 96% chance, between 90 and 96% risk protection. So for a person, let me say that again. So when you get vaccinated at an individual level, a person who gets vaccinated has between 90 and 96% reduced risk of getting having an adverse outcome like death. And for those who have breakthrough infections or go on to have severe illness, we then look at factors that may be associated with the increased susceptibility, like age, comorbidities, exposure, and whether you were immunosuppressed or not. And based on those factors, we can then earmark people who may be more vulnerable to adverse events or progression, even if they had got vaccinated. Then again, I don't know if I've answered that properly. So maybe you could expand on that if I haven't been too articulate.
No, I think, Glenda, you have actually answered it, and we can go into it in more detail if it hasn't reached. I thought I'd pick up the non-specific vaccination question, which I think is a brilliant one and an important one. So the question is, do other vaccinations protect against SARS-CoV-2? And those studies are underway. So I'll remind people that we have had a BCG vaccine study underway, fully accrued, and those data are expected. And we have a measles, mumps, rubella study underway at the moment, and that also is now fully accrued and is in the follow-up phase. So we can expect those results in the not too distant future. And it's a fantastic question, because obviously if those vaccinations are also helpful, we can add them to the armamentarium that we currently have. So very exciting field, and more to find out about that in the future.
Thank you very much, Prof. and Linda. There is a question from Tanya Faber of the Sunday Times, and the question is directed to Dr. Crisp. The question is, are there any plans afoot to prioritize pregnant women in the vaccine rollout in light of the data showing rise in maternity mortality? Dr. Crisp.
Thank you very much. Hello, Minister and colleagues. So at the moment, we're vaccinating pregnant women over the age of 35, and from the 1st of September, everybody over the age of 18 can be vaccinated. So we are encouraging all pregnant women to get vaccinated, but there's no specific deliberate program for any priority groups anymore, not for oncology patients, disabled persons, pregnancy, anybody. We are on a flat-out program to vaccinate everybody we can possibly get to, but obviously we are encouraging people with comorbidities, women who are pregnant, elderly people, those with conditions such as oncology treatment and so forth to come forward as part of the early groups for vaccination. Thank you.
Thank you very much, Dr. Crisp. There is a question from Tanya, and the question is, can all the existing priority groups like teachers, police, health workers, etc., still get jabs regardless of age, or have those priority rights expired? Thank you.
Thanks very much. I'll answer that as well. So I think everybody's aware there were a number of essential worker groups that we were targeting for early vaccination, and those programs are either completed or almost completed. Once the expiry date of each of those programs, where we are providing specific vaccination sites, have completed, if anybody in those groups is not vaccinated, they will need to go into the general vaccination program, make their own reservations or registrations and appointments and get vaccinated that way. The only exception is that we are still trying to vaccinate healthcare workers. Obviously, new people are being appointed into the system all the time, and as they qualify and come into the health services, we do encourage them to come forward, and we do make a specific effort to vaccinate healthcare workers. Thank you.
Thank you very much, Dr. Crisp. Now, this one is Makosonke, and what he wants to know is, can we be able to retrieve data on which side effects have been experienced by each of the vaccination age groups? Thank you.
Mr. Baloyi, I'm sure that should be towards rounding up, but I think possibly between Nicholas and Professor Glenda Gray, I'm sure they could take that question.
Minister, thanks very much. So what I will report on is that obviously we monitor all reported adverse events following immunization, no matter how mild or severe, and particularly every death that's notified after anybody has had vaccination is very thoroughly investigated. The function for this responsibility resides in the pharmacovigilance responsibilities or functions of SAHPRA, but the Department of Health, together with the regulator and others, have been preparing a website which was not yet live. And as soon as we have that data and it in a format that is visible and understandable for the public, the Minister will make an announcement and will make that data available. But everything is monitored very carefully, and we encourage that if anybody needs to notify an adverse event, we would like to know about it. There are forms on the NICD website, on the Department of Health's website, and elsewhere. Thank you.
Thank you very much, Doctor, and the panelists and the Minister. This brings us to the end of the Q&A session. But I will make a request that all journalists that feel that they need to ask further questions, they can do so by contacting the Department of Health, and also for post-briefing interviews that will be arranged. On that note, let me also thank the panelists, the Minister, and all who participated, and will then request the Director General to give us the closing remarks.
Mr. Baloyi, maybe just a minute before the DG, just to add a few points, just to say that, expand on a few points, just to say, as indicated by the independent pharmacists, we are indeed rolling out more and more sites, including in small towns and rural areas. All the small pharmacists, it's not only the big ones, the clinics, the discounts, but the independent pharmacists are also, we appreciate them. But just to say also that we encourage all provinces to also embark on outreach programs. Yesterday, I was in the province of Limpopo. Just as an example, we went into 2 farms where all the farm workers, in the 2 farms alone, close to 2,000 farm workers were vaccinated. So those are the workplaces and other outreach into the communities. Both the private and public are also going into those sites, and we want to encourage everybody. And I just want to close again by calling upon especially our plus 50 and plus 60 members of our society to please come forward, because that's the population at risk for vaccination. Thank you very much, and over to the DG. Thank you.
Thank you very much, Minister. DG Dr. Sandile Buthelezi.
Thank you very much, Mr. Baloyi. Good morning to the Minister, the panelists, members of the media, and all the colleagues. Firstly, I think it's befitting to, on behalf of the whole administration, to congratulate our new Minister, Dr. Joe Phaahla, our Deputy Minister, Dr. Sibongiseni Dhlomo, on their new appointments, and we will be looking forward to their stewardship. On the same breath, I would like to thank the outgoing Minister, Kabazela, for all the leadership he's provided us, and Minister Kubai, who was able to look after us for the past 2 months, and we really appreciated the leadership and the stewardship. For today, I think I want to thank the panelists for informing the public on all the issues that are currently pertinent issues. But for me, I think the take-home messages are, one, in terms of the COVID pandemic, we're not out of the woods as yet. Specifically, our coastal provinces are what we need to watch, but also we're worried about the Northern Cape, those districts as mentioned. So we are doing quite a lot of work, and our teams are on the ground to try and see what can be done. But the other provinces seems to be going down, but we must say that as government we can do as much, but it's in the hands of the communities themselves. Irrespective of the variant, our non-pharmaceutical interventions, they work. So please ensure that you stay home as much as possible. Don't go into crowds. You wear your mask. You don't need police to police you to wear your mask. You need to wash your hands, sanitize, and do all that is right. For vaccination, I think there's been very good presentation. The vaccine works, prevents hospitalization. It's not only on the studies that you've seen. We are seeing it as we're looking into statistics, as much as we're seeing, specifically with the healthcare workers. We're still seeing some infections, but the hospitalizations and the mortality was drastically reduced during the 3rd wave. So for us, we are really asking the South Africans, we'll do our best as the department to provide all the vaccines that are necessary, all the services, but it's the people that must actually encourage each other, specifically the young ones. Bring your parent, bring your granny when you go in, especially when we open up for the young ones, so that those who are really vulnerable are actually exposed to the vaccine. Lastly, I would like to thank my colleagues, all heads of departments, the provinces, for the stewardship that they've provided. Secondly, thank all the healthcare workers, as the minister has done. But more importantly, I would like to thank our colleagues from the private sector. We have a very good symbiotic relationship. We meet twice a week, we plan together, we ensure that we provide South Africans, we ensure that there's equity in the provision of health services. Thank you very much, Mr. Baloyi, and thank you very much to all the media houses for giving us an opportunity. Have a blessed day further. Thank you.
Thank you very much, DG. I was just checking, Minister is less than 12 hours on the beat, but he has already hit the ground running. This media briefing is urgent, and thank you very much. Congratulations again.
Thanks to you, Mr. Baloyi. Thank you.
Thanks, Baba.
Thanks, everyone.